So we've got a few different types of filler, some lasting a bit shorter, anywhere from 5 to 6 months, some 12 to 18 months. But again, that goes back to patients' metabolism. So if they've got a very fast metabolism, they go to the gym a lot, they work out, and usually if they've got a good, they eat anything they want to eat and they don't put weight on, they do break down fillers faster than others, and then sometimes it lasts, even the one that we say lasts 6 months, it can last from 12 to 18 months. If you're having Botox treatment, you can fly a couple of days after. Some patients fly the next day, but we always say within that 2 weeks they can have different results because the eyebrows can move up, down. With fillers, we recommend them not to within the first week or two, because in case there's anything that they like to show us, or there's anything emergency we need to see them, we can call them in. It's best not to, but there is no scientific evidence saying you can't travel. And then if you've got Profilo or any skin boosters like polynucleotides, you can travel, but you will have some downtime, like a little redness, spots, like spot treated treatment under the eye. But if you're okay with that, fine, you can travel. No, so breastfeeding, pregnancy, immune disease are one of those contraindications for any treatments, not necessarily Botox, fillers or aesthetic, but I think when it comes to that, most treatments are no. Depending what treatment. So Botox, usually get a bit of swelling sometimes around the eyes. That's just more superficial injections. Lasts about half an hour, it's fine. Fillers, yes, you can get bruising or swelling for the next week or so, but sometimes patients do, sometimes they don't. Yes, yeah, you will see results immediately. Filler is different to Botox, so when we volumize the area, if we've got enough material products to use, then they will see the immediate results before and after. So you can see if you're very flat in your medial cheek, then you'll see a nice lift around the cheeks. What we use is reversible, is hyaluronic acid. We're working with Juvederm, but there are certain fillers that are non-reversible, and we advise patients against them. And we don't use them in the clinic, because if there is anything the patient doesn't like, or there is emergency vascular occlusion, anything that we need to dissolve, at least with the non-permanent one we can do that, but if it's permanent, there's nothing anybody can do. To be fair, I would say 48 hours, good 48 hours. Sometimes you can get bruising or little lumps come up around the face, depending where you have it, whether it's a neck, face, body, but 48 hours. 4 weeks prior to the event, in case if there is any issue with the eyebrows lifting or any droopiness, then everything, all the muscles settle itself out within the 4 weeks. So it's a good time to not look at too close to any event. In a good way, yes. So they usually, if it's a good treatment, nicely done, they usually look at you thinking that, you look really nice. Have you been on holiday? If it's done to the obvious point, everybody will see that they've had a treatment, and that's what puts people off most of the time. But yes, they will see some things different, but in a good way.